Okay, it looks like we are live. Good afternoon, everyone, and welcome to day 2 of the Boys Town Pediatrics Newborn Expo. My name is Gabby. I'm your moderator for the week. We are going live every day with a Boys Town pediatrician to discuss an array of topics to help you best prepare for baby. Today, we are live with Dr. Danielle Empson, and we're going to be discussing what happens at the hospital. As we go through our live discussion today, make sure you leave a comment so you can be entered in today's giveaway. We're giving away a Boys Town Common Sense Parenting Baby Bundle. So we will do that at the end of this live after our Q&A. As we're talking about what goes on at the hospital after delivery, if you have a question for Dr. Empson, make sure you leave that in the comment section, or you can send it privately to our Facebook page. We are monitoring that inbox as well. Dr. Empson, how are you doing today?
I'm doing great. Thanks for having me. I'm very excited to talk with you all today.
Yes, it's always great to have you on. Tell us a little bit more about yourself and your role at Boys Town Pediatrics.
Yes, I'm Danielle Empson, one of the Boys Town pediatricians. I work at the Maple Street Clinic, which is our newest pediatric clinic at 168th and Maple. It opened in April 2022, but I started working at Boys Town in 2016. I love working for Boys Town. I have 2 little kiddos of my own now too, so I feel a little bit seasoned in this topic today, and I'm happy to answer any questions that you guys have at the end.
Yes, wonderful. So when parents-to-be choose a pediatrician, they are with the family from day one, starting with rounds at the hospital. When pediatricians visit newborns at the hospital, what are you looking for?
Yeah, so we will meet with the families and meet your baby within the first 24 hours of delivery. And during that time, then we kind of check over things, make sure that baby is transitioning well to life outside of the womb and that things are going well with you guys. And just make sure that baby is looking well, has fingers and toes and breathing okay and all that good stuff.
Mm-hmm. Yeah. So let's go into more of what happens in the hospital after delivery. First, let's talk about skin to skin. What is it and why is it so important?
Yes, so skin to skin is one of my very favorite things. Skin to skin happens right after the baby is born. As long as baby comes out healthy and crying appropriately, the nurses will put the baby on the mom or dad's chest. And that way there's just really great bonding. It's exactly what it sounds like, direct skin to skin contact that helps keep the baby nice and warm and just is really good for boosting milk supply for mom and making sure that baby stays nice and cozy. They try to do, we call it the golden hour. So they try to do skin to skin for at least an hour before any other interventions are done. So it's a really nice bonding time and it can be with the mom or the dad, which is great.
Yeah, that was going to be my next question. I see, photos of mom with baby and then dad with baby. I didn't know if one is first or if it mattered, but
yeah, no, it doesn't really matter. For me, for my first, I think I did skin to skin for like 2 hours before I even let my husband touch our son. And then I realized later, I was like, oh my gosh, he's 2 hours old and you haven't even been able to hold him. But it's just such a nice bonding experience and is great.
Mm-hmm. So after skin to skin, what is next?
So after skin to skin, then the nurses usually take the baby over to like the warmer weighing station so they can do vital signs, check measurements that they'll let you know how much the baby weighed and how long your baby is. They also, that's when the nurses will do like their hepatitis B vaccine. That's the first vaccine that your baby will get. And then they do some eye ointment to protect against bacterial infections of the eye, as well as a vitamin K injection. So that's another shot that babies will get right away to help prevent with any bleeding that can happen early on in the newborn stage.
Mm-hmm. Let's talk about feeding after baby. So when does that happen? And then what type of support will parents receive when feeding their baby the first few times?
Yes. So whether you decide to breastfeed or bottle feed, that usually happens during that skin to skin time, during that golden hour. So if you decide to breastfeed, that skin to skin is really great to kind of increase that oxytocin, that breastfeeding hormone, and help with milk supply. And then if you decide to bottle feed, you can also do it within that first hour as well. The nurses will be there to support you. And then throughout the hospital stay, there's also lactation consultants that will come in the room, make sure that feeding is going well, baby's latching on okay, and help with any tips and tricks on how to hold your baby to get a good latch, or working on making sure that the baby's feeding okay. And that milk is, coming in. There's not right away, there's not a ton of milk production, but that happens over the first few days of the baby's life.
Mm-hmm.
And so we just make sure that everything is getting ready for that buildup for the milk to come in.
Yes. And in case you missed it yesterday, we did a whole live with Dr. Monica Kelly on feeding. That included both breastfeeding and formula feeding. So we'll make sure to link that video in the comments and you can go back and watch it too. Okay, so the next question is, we talked a little bit about when baby is taken by the nurses, what are they doing to him or her? Is there anything else you wanted to add beyond what you mentioned already?
I don't think so. I think the nurses are really great at letting the doctors know if there's any concerns that have come up that we need to talk with the family about. And so I always advocate that the parents also bring up any concerns that they have about their baby to the nurses. Since the doctor, like I said, you'll see your doctor within the first 24 hours. And then every day that you're in the hospital after that, the doctor will come and examine the baby. But the nurses are really the ones that are there hands-on throughout the day with you. And so any concerns or questions that come up, they are great with helping out with all of those answers.
Yes, definitely. I know you talked about the vitamin K shot. What is that for and why is it done to baby?
Yes. So vitamin K helps with our clotting factors and helps get our clotting system ramped up. Babies are born with what we call a sterile gut. So vitamin K is made in our body after bacteria has been in our body a little bit in the gut, which happens after birth. And so the vitamin K injection just kind of helps build up that clotting cascade to make sure that there isn't any major bleeding episodes, which is high risk within those first few days after delivery, just because delivery can be a little bit traumatic.
Yeah, definitely. I'm seeing a lot of great questions come through in the comment section. Just a reminder, keep the questions coming and we'll do a live Q&A here at the end. What other tests will be done with baby during their hospital stay?
Yes. So, like I mentioned, those very first measurements are taken right away or after a first couple of hours after that skin to skin golden hour. And then the first 24 hours, I always tell families, is really working on feeding and peeing and pooping. The next 24 hours is when we do some further testing. So that includes a hearing screen. All babies will get their hearing checked before they leave the hospital. And then if there's any concerns with that, then we refer to Boys Town Audiology to follow up and do a secondary screening on that. Babies also get a congenital heart screening check. So we check an oxygen in a hand and a foot and make sure that the oxygen levels are okay. Both of those testings are non-invasive, which is really nice because they can sound a little bit scary or intimidating. But I always remind parents it's putting the little headphone things on and then putting the oxygen probe on a hand and foot. So nothing too invasive there. And then a newborn screen, that one is a heel poke. So we do a little blood draw and send that off to the state lab. That's done after 24 hours and checks for a bunch of different metabolic conditions that can be treated early and right away. So that's why we do them. Things on there include things like cystic fibrosis and like immunodeficiency syndrome and things like that. So we always check those. And then that usually comes back to your pediatrician at like the 1 to 2 week mark. So they follow up with you outside of the hospital with the results on that. Lastly is that we check a bilirubin screen or that jaundice level, especially if baby's getting a little bit yellow of the skin. That can be like a skin test check. There's a special machine that they kind of scan the skin to see what the number is. If it's elevated, then they double check with a blood draw. So another potential blood draw there. And those are kind of the big tests that we do before leaving the hospital and after that 24-hour mark.
Perfect. The next question is, should I bathe my baby at the hospital or wait until we get home?
So that's kind of parent preference. A lot of times babies will be bathed sometime after the 12-hour mark, just to make sure that temperature has been stable and everything like that. And then nurses can kind of show you how to bathe your baby for the first time, which I always think is super helpful. Kind of keeping the baby, how to keep the baby wrapped up and warm, do one arm at a time, the face and all of that stuff. So you definitely can do it in the hospital. If you want to wait until you're home, that's totally fine too. But we usually say sometime after the 12-hour mark, it won't happen right away.
Mm-hmm. The next question is, will my baby sleep in the same hospital room as me that night? Or do you want to talk maybe about the nurseries at hospitals, how those work?
Yes. So we try to keep the babies in the room with the parents as much as possible. That, again, helps with establishing that good bonding. And especially if you're a breastfeeding parent, that will help with kind of following those feeding cues and things like that, and figuring out when the baby's hungry and trying to feed. But some parents want a little bit of a break or need a little bit of rest, and it's totally fine to have your baby go to the nursery for a couple hours overnight. So that the nurses can kind of watch over things as well. But I feel like from what we've seen in like Hollywood and the movies, there used to be just the rows of babies in the nursery, and that's not so much how our nurseries and the hospitals look anymore. We try to keep the babies in the room with the parents as much as possible. And I think that's kind of better for the parents and better for the baby. And everyone wants their baby to be right there with them anyway, right when they're born.
Yeah, definitely. How long is the typical stay at the hospital after delivery?
So most families will stay 1 to 2 days after the baby is born. So it depends kind of how long of a labor you had leading up to that. But once the baby's born, usually 1 to 3 days, kind of depending on the mode of delivery. If baby is born vaginally, 24 to 48 hours is typical for time to stay in the hospital. And then a C-section closer to like the 3-day mark.
How often will we see the pediatrician during our stay?
So like I mentioned in the beginning, the pediatrician comes within that first 24 hours, and then we come every day after that while you're still in the hospital. And then we kind of talk with you about when to follow up outpatient.
What support is offered for parents after delivery? This mom wrote in and said, I'm feeling overwhelmed with all that happens afterwards, with all the tests and everything, and then also visitors.
Yes. So the support, again, I say like talking to your pediatrician, talking to the nurses, talking to the lactation consultants, utilizing them as much as you can while you're in the hospital, because you don't have as easy of access to them after leaving the hospital. However, you definitely still have access to your pediatrician, to Boys Town clinics. We have 24/7 nurse access. So that's a little plug there. But if you're feeling overwhelmed or feeling like, I need a little bit of rest or a little bit of shut-eye, like I said, definitely okay to have your baby take a little break in the nursery. The nurses could then do some of those screening tests during that time if needed. And then the other thing with visitors, I always tell families when I'm doing like the meet and greets before baby is born, just give yourself some grace. If you don't want visitors, that's totally fine. My first baby was born like the winter of COVID.
Yeah.
And we just didn't, visitors were allowed at that time, but we just didn't want anybody to come and visit. And it was actually a really nice experience because then we just got to enjoy our baby and Didn't have to worry about, oh, this person's coming at this time and this person's coming at this time and I need to take a rest at some time. So just giving yourself some grace and doing whatever you feel comfortable with. And family members, visitors are usually A-okay with that.
Definitely understanding. We just have a couple more questions and then we'll hop into the Q&A. So if you're watching live and you have a question, make sure you leave it now so we can hopefully get it answered in time. If you're watching this video later tonight or maybe a couple days from now after the live portion concludes and you have a follow-up question, message our page directly, leave the question in the comments and I will follow up and get you the answer you need from Dr. Empson. When do we see our pediatrician with our newborn after we are discharged?
Yes. So on the day of discharge from the hospital, the pediatrician will go over things with you, what to expect when going home. Again, we talk about monitoring the feeding, the peeing and the pooping, all that good stuff. And then we'll tell you when to follow up. So a lot of times it depends on a couple things. One of the things is the weight. Sorry, my computer. Okay. I want to make sure it didn't lock out. The weight. So all babies will lose a little bit of weight after they're born, and we want to make sure it's not more than 10% of their birth weight. So that kind of contributes to when we decide to follow up. If it's closer to that 10% mark, we may have you follow up the next day or a couple days. If baby's feeding well, hasn't lost a lot of weight, then it may be three-ish days, but usually within 1 to 3 days after leaving the hospital. The other thing that we're following, like I had mentioned a little bit before, is that bilirubin or jaundice level will kind of tell us when to follow up too. If the number's a little bit on the higher side, we may want to follow up sooner and get that level checked outpatient. If the number's nice and low, then we kind of let it ride and may give you a couple more days.
Yeah. This question's not on my list, but I thought of it while we were talking. I want to know from you, I know you do a lot of rounds at the hospital. What's your favorite part of doing rounds and meeting with these families?
Oh, that is such a good question. I think it's just being able to see like that brightness in everybody's eyes with a brand new baby is such just a wonderful feeling. And being able to be a part of that, I think, is so special as a pediatrician. I always think it's very neat for like the OBGYN doctors. They're the first person to touch your baby oftentimes before the parent, which is such a cool job. And we're right up there with them. And so I just feel very lucky that I get to do that and be a part of this just life-changing, awesome experience.
Yes. Before we hop into our Q&A, Dr. Empson, I want to ask you, if people are watching and they're interested in setting up a meet and greet with you, how do they do that?
Yes, so you can visit our website, boystownpediatrics.org, or call our clinic, and we can get a meet and greet set up either in person or virtually. I think Gabby may have a link for you too, if you want to do it that way.
Yep, we'll put it in the comments. Why is it important to do a meet and greet before delivery?
Yeah, so we do them a lot in our clinic. It's just a nice way for you to get to know the doctor ahead of time. We talk about things that aren't necessarily medically related, like where did you grow up? Where are you from? And I tell you guys a little bit more about myself too. So you get to develop a little bit of that rapport. And then when we're coming to round in the hospital, we're not a new face that you're seeing for the very first time. So that's I think it's nice to have those meet and greets ahead of time. Totally not necessary, but we're happy to do them.
Perfect. Okay, so we'll hop into the Q&A. I'll try to get through as many as we can. And thank you all for watching live and leaving such nice comments and questions. It's always fun. Okay, so this one says, when does milk usually come in?
Yep. So again, kind of depends on like mode of delivery. Oftentimes vaginal births, that milk will come in a little bit sooner than C-section, but usually around the 3-day mark. But there is that colostrum. I don't know if Dr. Kelly talked a little bit about that yesterday, but if you missed that, colostrum is that very early, super nutritious, thick breast milk, and that maybe baby even just gets a couple drops that first feeding, but so nutritious and all that baby needs. And the more the baby feeds, the more that milk supply is stimulated. So usually about day 3, sometimes like if babies are born a little bit early, or like I said, C-section deliveries can take a little bit longer.
Yeah. Would my normal family practitioner also do pediatrics, or do I need to find another doctor?
You would have to ask. So some family practice providers do pediatrics as well. And I think some would probably go to the hospital and do rounding. But if not, like a general pediatrician, I say is definitely the way to go.
Definitely. This kind of goes along with the meet and greet question, but someone asked, at what week should I start looking for a pediatrician? Do you recommend doing that early in pregnancy, or is there a timeline that you prefer?
I don't think it really matters. We meet people at all stages of their pregnancy. It just kind of depends if they're really gung ho in the beginning and want to meet a pediatrician right away, but it doesn't really matter. We're not going to get like taken up and then you can't see us anymore. So I think that's the nice thing, is that there's not really a limit. So anytime is fine.
Good. What are some of the most important things to have in my hospital bag?
Ooh, very good question. Is there going to be another topic on this? I know we've done that in the past.
We've done it in the past, so
Yeah.
I'll link that video. I think we had a whole video on hospital bags, so I'll link
Yes.
that. But maybe from your experience, what are the
Yes.
things that you brought?
Definitely some cozy pajamas. A lot of like the feeding things and like postpartum care things they have for you in the hospital. So you don't need to pack a ton of that stuff. We always say a phone charger is really nice to have, because you want to make sure to catch all your videos and photos that you want right away. And then just a couple outfits for the baby and like going home clothes for you. They always want you to bring up the car seat. Gosh, I'm trying to think. I don't know. I think cozy pajamas was kind of the biggest thing for me.
Yeah.
After a lot of people deliver like in their gown. You don't want to get your cozy pajamas dirty, but then you get to change into your cozy pajamas. And
Yeah.
I thought that was great.
Comfort's key, guys.
Yes.
The next question is, we touched on jaundice, but this is a good follow-up. When does jaundice usually become an issue? My first baby had it and was readmitted less than 24 hours after discharge for first-time jaundice.
Oh, yes, I know. I'm so sorry. I hate when that happens.
Yeah.
And it's hard for it. There are some risk factors that we look for. So looking at like mom's blood type and then seeing if there's mismatch between baby's blood type, that can increase the risk of jaundice. If the baby's not feeding as well as we'd like, or not, or losing like too much weight, those are risk factors for jaundice as well. And so what we look at is like the number of that bilirubin level and then how many hours old the baby is, because every hour old, we allow that number to be a little bit higher. And there's tables and charts that we look at. And if baby crosses the threshold, that's when we usually decide that baby needs a little bit more care or a little bit more frequent checks on the bilirubin or jaundice level. I hope that answered the question. But yeah, we look at different risk factors and then we kind of determine the level and how quickly it's rising. And those all sort of play into role.
When should you meet with a lactation consultant?
Yes. So when I do all of my meet and greets and families want to breastfeed, I say meet with the lactation consultant as much as you can. Whenever you're in the hospital and you are trying to feed your baby, press that call button and have someone come in the room as much as you can. Breastfeeding, everyone thinks, is kind of this natural thing that happens, but it does take a little bit of work, and some babies more than others. And so if you can have that support available, using them as much as possible, I think is great. And if the lactation consultant isn't available, call in your nurse, because they're great resources as well. The pediatrician is often a great resource too. So even if they're not truly lactation consultants, they have a lot of expertise in that area because they've seen it a lot. So yeah, I say utilize them as much as you can. And then I always do a little plug for, even after leaving the hospital, there's still support, your pediatrician's office. And then there's lots of lactation support in Omaha as well, which is nice. And I give that to all of my patients too.
Wonderful. After my first baby, it was during COVID and there was no nursery to use. Oh, I think we talked about this already. I'm sorry. She said, are nurseries a thing now, or will baby be in the room the whole hospital stay? So just to echo it, it's there if you need it.
Yep, it's there if you need it. Yeah, but I think most of the hospitals have kind of gone towards keeping the baby in the room and close to mom as much as possible, just because we've found that's better for bonding and breastfeeding and all of that. But there is nursery if you need it.
Is it common practice to do the newborn screening in the middle of the night, or do they just wait 24 hours for testing? Mine was in the middle of the night, she says.
Yeah, so they typically just wait until that 24-hour mark, and wherever that falls, if your baby was born in the middle of the night, then that test may happen in the middle of the night, and it kind of just depends on when the nurse is free, the lab tech is free to do that, but sometimes they'll just get it done in the middle of the night. So we don't have much of a say. We as pediatricians don't have much of a say as when they do that, except for that it has to be after the 24-hour mark.
Mm-hmm. Yeah, we got a couple questions on circumcision. Can we kind of talk about that? When does it happen? Who does it?
Yes. So circumcision happens in the hospital before you leave. And that will either be done by your OB if they perform the procedure. If not, then the pediatrician can do the circumcision. I do circumcisions. Some pediatricians don't, so it just kind of depends. And then if the OB nor the pediatrician do them, then there's also usually like a circ team where somebody from like the NICU or another provider will do the circumcision before you leave the hospital. That usually happens after baby's about 12 hours old, sometimes 24 hours old. And we usually like to wait until after baby has a bath. So making sure, again, temperature stable, the baby has gotten the vitamin K, and then the circumcision happens. And we talk, usually whoever's doing it will kind of give you the rundown of the procedure and what happens during the procedure and afterwards. And then it's done in the nursery. So we'll take the baby to the nursery, get the procedure done. It usually only takes 5-10 minutes, and then bring the baby back to you and carry on.
Yes, perfect. Great question. The next one is, when do you recommend siblings meet new baby?
Yeah, so that's everybody's own kind of preference, but I think I don't know, I guess it's once you feel sort of settled in and like after that golden hour, I think anytime after that really is appropriate if you guys are comfortable with that. I will say so my second she'll be 1 next month. Oh, yep, next month. And when my first met her delivery and everything, thank goodness, everything went very smoothly. And so a few hours after she was born, we had our son come up and meet her, and everything went really smoothly that way. And it depends, like some hospitals are a little bit, will have like guidelines on the age of visitors and things like that. But usually siblings of babies can come, for a little bit. And our son was almost 2 at the time. And so he was able to come up for, an hour or so. And then, yeah.
In a previous Newborn Expo, I believe it was in the spring, maybe last winter, I've done a few of these now, but we did a live topic all about helping siblings adjust to new baby. So I've saved all our previous Expo videos in one playlist on Facebook. So we'll link that in the comments as well and in the event page. So if you're an expecting parent and you wanted to scroll through and watch a lot of these interviews, we've done an array of topics. So I'll link that.
Yeah, and that's super helpful. I think I looked at those videos with my second, just like, how do I get my son to make sure that he's not super overwhelmed with a new baby sibling?
Yes, definitely. Even pediatricians need tips sometimes.
That's right. That's right.
All right, we'll do 2 more questions and then we'll go ahead and draw for the giveaway. Most fun part, right? The next one is back to milk coming in. When does it come in usually if a baby is preemie? Does that change the tempo of it?
Yeah, so I mentioned that a little bit. Milk can come in later with those preemie babies, and kind of depends on how premature, but closer probably to like the 5 to 6 day mark rather than that 2 to 3 day mark. And again, depending on how premature the baby is, if you're in the NICU, then there's going to be a totally different like feeding regimen. But I will say that most of the hospitals in Omaha are great if you feel like there isn't enough milk and you want you don't want to do formula, there's the option of donor breast milk. A lot of hospitals are using that, which is fantastic. And so just keeping that in the back of your mind, like, oh, I think my baby needs something. I don't know if my milk is in yet, or if it's coming, or the baby's not getting enough or not latching. Then you can do formula bottle feeding or donor breast milk, which is amazing.
Mm-hmm. Yeah. And then the last question we're going to answer today for the live is going to be, after we're home from the hospital and what's the tempo for like the first couple pediatrician visits? How often do you go, maybe in the first couple weeks?
Yeah. So I talk a lot about this at the meet and greet sessions too, because early on, we always see babies and young kids much more frequently than we do when they're a little bit older. So, like I said, that first visit after leaving the hospital is usually within a day or two. And then depending on feeding and peeing and pooping and weight gain, then we kind of determine the next visit after that. So sometimes that one may be even a couple days later. And then oftentimes we'll do like a 1 or 2 week visit, sometimes a 1 month visit. And then the standard kind of first big visit after those newborn visits is the 2 month visit where baby gets their first set of vaccines.
Very good. Wonderful. Okay. Well, lots of great questions, everyone. So thank you. And like I mentioned, if you have any follow-ups, go ahead and comment them, send them to our page directly if you want, and I will facilitate an answer from Dr. Empson for you. Okay, so the giveaway winner, drum roll, so that's a Boys Town Common Sense Parenting Baby Bundle, is going to be Anne. Anne, congrats, Anne. We will message you directly from our Facebook page to claim your prize. And don't worry, we still have 3 more lives this week and a grand prize giveaway. So keep watching every day at noon to be entered. Tomorrow we're going to be live with Dr. McCarthy, and that topic is developmental milestones within the first year. So that'll be a great one, and we look forward to it. So Dr. Empson, thank you for your time. It's always a joy chatting with you.
Yes, thank you guys. Congratulations. Good luck with everything. We hope to see you.
Yes, we hope to see you both on our lives and in the clinic. So thank you, everyone, and we'll catch you tomorrow. Bye-bye.
Bye.